Welcome to the Saul's Newsstand News Review for August 9th, 2019. The Hill reports, conservatives buck Trump over worries of socialist drug pricing. Conservatives are growing increasingly uneasy with the Trump administration's new drug pricing policy. President Trump is desperately seeking an elusive political win in his efforts to lower prescription drug costs, but he faces a hard sell to conservative groups and GOP lawmakers as he touts ideas traditionally favored by Democrats and presidential candidate Senator Bernie Sanders. In a rare break with Trump, conservatives are now pushing back against key administration policies and accusing the president of supporting what they call Sanders-style socialism. The president has embraced importing drugs from Canada, as well as international pricing policy that would bar Medicare from paying more than other countries for prescription drugs. President Trump has made lowering drug prices a top priority of his presidency, but he has suffered some high-profile setbacks in recent weeks. He has frequently railed against global freeloading and said he doesn't think it's fair that the U.S. subsidizes research and development in other countries. Last year, the president went to the Department of Health and Human Services and announced a plan to cap U.S. payments for expensive drugs over the objections of some White House advisors. An op-ed from the New York Post states, Medicare for all is a dire threat to Medicare for retirees. Baby boomers beware. If you are in your 50s or 60s and you're counting on Medicare to pay your future hospital bills, you might be in for a shock. Medicare Part A, the fund that pays hospitals and nursing homes, is running out of money. A mere 7 years from now, it will no longer have enough to pay your provider's bills in full. The Medicare trustees sounded the alarm in June, urging Congress to act as soon as possible to protect people already dependent on the program. Good advice, but don't expect politicians to take it. The Democrats running for president are in a fantasy land, proposing to expand Medicare to millions of younger people or even the entire population through Medicare for all. Never mind Medicare's insolvency. That's like a family that can't pay its mortgage out shopping for a mega mansion. Amazingly, in 4 national debates so far, not one moderator has asked the presidential wannabes how they would secure Medicare's finances and keep the promise the nation has made to its seniors. As if people 65 and over don't count. Message to the Democrat Party, if they don't count on their votes. We would encourage you to read the full op-ed by clicking on the link in the description below. And finally, an op-ed from Fox News says, how much would Medicare for all really cost the middle class? The answer is shocking. During the most recent round of Democratic presidential debates, nearly all the leading candidates reiterated their commitment to transition the United States health insurance industry to a Medicare for all, government-run model. Some promised to do it more quickly than others, but in the end, the result would be the same. The federal government would control healthcare within a decade. Single-payer healthcare systems are plagued by countless problems that should make them an unattractive option for lawmakers, including rationing, service shortages, and bureaucratic inefficiencies. But perhaps the question most important to many 2020 voters, especially those with full-time jobs, will be how Democrats plan to pay for a gargantuan government takeover of healthcare, one that would include paying for nearly all healthcare services, reproductive care, and even pharmaceuticals. Contrary to the claims made by the leading Democratic candidates, millions of middle-class earners would be hit particularly hard under Medicare for all. For example, filers earning $50,000 to $75,000 would likely need to pay an average $7,773 to $9,171 more in taxes. Those families earning $75,000 to $100,000 would pay $12,612 to $14,880 more. Most households with more than $100,000 in income would pay close to or more than $20,000 in additional taxes. And that concludes your Saul's Newsstand News Review for August 9th, 2019. For more political news faster, visit saulsnews.com.